Good evening, my dear residents. I am Dr. Bharath Kathi, so consultant pulmonologist. So today I wanted to be more interactive and I want you to give you the real life situation of pulmonology in our country. So I have my first year resident. See, myself, I'm in more than 10 years in this field and he's just 1 year old. So you will know the perspectives of both of us. So what can be done in 10 years in this field, and as a first year postgraduate or somebody aspiring to get into respiratory medicine, what are the things that should be there in your mind? I just have a small PowerPoint presentation so that I can let you know the important aspects of the branch per se. Just a minute. Okay. Now, starting with respiratory medicine and pulmonary medicine. So the first question people ask me is, sir, what is difference between respiratory medicine, pulmonary medicine at MD level, and what is TB and CD, and what is TB and RD? They all mean the same. As per, just a minute. Okay. So as per recent NMC guidelines, so what they have done is they have made respiratory medicine as MD degree, DM pulmonary medicine as super specialty, and the old terminologies TBCD, TBRD have been removed. So just spend 10 to 15 minutes, my dear students. So later I will take up all the questions. First, try to understand what is this branch. And because most of you people may not be aware of this branch in your UG days. So I would like to tell you regarding the branch, then I'll take up all the questions. Okay. Then let us see what is respiratory medicine. This is what I do. I fix the lungs and I know things. So people thinking that respiratory medicine has been removed from medical colleges. So it has been removed as a mandatory criteria for medical college establishment because they feel respiratory medicine, cardiology, neurology, nephrology or focused specialties. To start a medical college, just general medicine is sufficient. So no need such advanced focus specialties. So to make the process easier, they have excluded it. They did not remove it. Postgraduate training will be there. And moreover, then all the eligibility to practice, super specialty, everything will be there. So I being 10 years into the field, myself, I am not worried about it. I don't know why other people are worried. Okay. So myself, I am Dr. Bharath Kathi. So I have done my MD DNB fellowship in interventional pulmonology, allergy and clinical immunology, and I have also qualified European diploma in adult respiratory medicine. So first of all, what are the pros of getting into respiratory medicine? So this was my thought process. I was always of the view that I want an end branch because down the lane, MBBS 5.5 year, 1 year drop for PG preparation. I felt that 3 years is enough of my life to get into some specialty. So it's satisfied. And moreover, this is not just a medical branch, and this is not just a simple medical branch. So you have wings into interventions, sleep medicine, critical care, allergy, and eligibility of DM cardiology and DM critical care was the initial force for many people to get into respiratory medicine in 2010 and 2015. But now they are getting into respiratory medicine to be solely a respiratory medicine specialist or later to pursue DM pulmonology. And in simple words, it is a medical branch with the surgical touch. See, I think most of you must be knowing in a medical branch where there is money when you can do some interventions. See, for a gastroenterologist to be well versed with colonoscopy or endoscopy, he should be after medicine, he should again pursue 3 years of DM. But for respiratory medicine, to put a bronchoscope or thoracoscope or do any kind of intervention, your MD degree is more than sufficient. Then what are the negatives of respiratory medicine branch? First thing, people say that there is limited spectrum of cases. So this is what they argue while choosing whether I should take respiratory medicine or internal medicine or any other broad specialty. So my observation down the lane was majority of the people who take general medicine, 3 years, they see all cases. Next 3 years, they only go for cardiology, nephrology, neurology, rheumatology, gastroenterology, medical oncology. So ultimately, now the trend is specialty. Again, in cardiology, there are again types. So some people go into electrophysiology, some people go into invasive, non-invasive cardiology. So you accept or don't accept. Ultimately, at the end of the day, there should be something very special about you. So this is the trend of what you call a focused medicine and also subspecialty. But this is what I felt many people are avoiding, occupational risk. So I'll give you an example. So most of the people think that a lot of TB patients will be there, MDR patients will be there. The chances of residents getting tuberculosis is small. So I have been into medical college for the last 10 to 12 years. Till now, no respiratory medicine resident under us have developed tuberculosis, but we commonly see internal medicine, radiology, ENT, OBG postgraduates getting tuberculosis. The reason behind this is because in respiratory medicine, you feel each and every case is tuberculosis unless and until proved, and you take maximum precautions. So your wards are in such a manner that so each patient has sufficient space to be isolated. And you know that there is risk, so you'll be extra cautious. But when you go into regular OPs just as general medicine or ophthal, patients will be coming onto your face. You don't know whether, are you screening them for tuberculosis? No. So the problem when unscreened population come, so to delivery, somebody will rush into the emergency department. So if you solely take occupational risk as a con, occupational risk can be everywhere. So even in a radiologist room, closed setting, AC will be there, ultrasound, a TB patient, unknown TB patient has come, he has coughed. So there are chances. So tuberculosis always depends upon your body's immunity. Make sure you are a resident anywhere. My sincere request for you is, even though you are even anatomy or physiology or psychiatry resident also, take precautions for tuberculosis. But fortunately, now we are targeting elimination. Maybe after 5 years, this occupational risk may not be there. Have seen radiologists also get affected. So though cases may be limited, but you have the joy of comprehensive evaluation and treatment decision. So you no need to ask for anybody in respiratory medicine per se. So you are the boss of the case. So you are a master of that case. So you will have that joy of complete evaluation and treatment decision. So if medical branch is your choice, I want to get into medical branch. Medicine is my passion. I could not get general medicine. I could not get pediatrics. Respiratory medicine is there for you. And you want medicine with some surgery. Sir, I am not a vigorous surgeon opening up all the peritoneum, breaking bones, or doing joint replacement. I have some interest in surgery, but predominantly my mind is a surgeon. I mean, my mind is a physician, my hand is a surgeon. So then also respiratory medicine fits you well. Because these days we are having so many interventions that I'll let you know later. So then the next question that people ask me is, what will be the pay? Is it on par with general medicine passed out? So as long as you are in government or private medical colleges, your pay scales will be very similar. So in medical colleges, in medical college job, your pay scales are very similar. But once you get into small hospitals, usually in private corporate hospitals, so I'm speaking about in 2-tier cities, the salary of a respiratory physician might be less because it all depends upon how many cases per day you see. But definitely once you start doing procedures such as bronchoscopy and thoracoscopy, the cuts you get will be way more bigger. See, what I say is, after completion of your branch, don't think patients will be running to you saying that this doctor has completed medicine, this doctor has completed surgery. You have to build up your own patient pool. So the advantage here is, apart from doing OP practice, if you start doing some interventions, you might get good salary. Then I wanted to do DM cardio. Is MD Pulmo better option than MD Med? So in no way it is a better option, because MD Pulmonary Medicine is separately a bigger branch, and it is separately a focused specialty where there is a lot of advances going on. So you want to do DM cardio, but I don't want to get into MD Med studying everything. Can I go into MD Pulmo? Not actually. Reason MD Med has wide spectrum of DM fields. And one more thing, initially you might feel I want to get into cardio, but most of the medicine residents that I have seen down the lane, in the second year they choose nephro, endo, or gastro. So these are not possible with MD Pulmo. Keep this in your mind. So MD Pulmo is only eligible for DM pulmonary medicine, critical care, and DM cardiology, infectious diseases. Whereas other specialties, you're not eligible. And most of the people, medicine residents also, who come to do DM cardio, later on, they change their decision in the second year. So if you think DM cardio, MD Pulmo should not be your first option. But by chance, this word is very important. You're passionate. You are in love with cardio. You are in love with cardio. I want to sleep like a cardiologist, walk like a cardiologist. I want to be a cardiologist. Then if MBD medicine is not there, you can go for pulmo. Then how to prepare for cardiology? So you have to again complete Harrison, because when you are writing NEET SS exam, you have to write medicine paper, not just a pulmo paper. So that's why side by side, you should be well aware of other systems also. Then coming to, is DM Pulmo mandatory? So this is the biggest question that I get these days. I will try to solve it with a practical example. Now see here. Suppose you are thinking to get married. So marriage here means practice in a field. I'm just giving an analogy. And you are in relationship for 3 years. You are in relationship for 6 years. So ultimately, it is the same person with whom you are in relationship. So maybe if you are in relationship for 6 years, so you will have more understanding about that person or about that branch, and you will be more confident, and there will be more stability in your decision making. So same way, I elaborate it to MD Pulmo and DM Pulmo. So you are ultimately getting married. That is, you are coming out as an individual private practitioner. Whether it is 3-year relationship or 6-year relationship, it all depends upon your personal perspective. So if you feel within 3 years and 1 or 2 fellowships, you're confident. So it is equivalent to a person with 6 years relationship. So it is all your personal perspective. But let me give you a practical thing about DM Pulmo. So like I told you, it is not mandatory. So yearly you have only 70 to 80 DM seats, but yearly we have about 700 to 800 respiratory medicine residents. So the ratio is 1:10. So everybody cannot get into DM. So private practice, or if you are getting into a medical college job, no issue at all. You will be well recognized. So the only problem arises in metro cities when there is a big corporate circle. So there they first see the degree. So in corporates and cities, the DM is more than or equal to. So it's not just more, it is also equal to MD with good fellowships. And definitely when compared to fellowship person and DM person, so only MD respiratory medicine has a slight disadvantage. Okay, this is the difference. So it is the same person. It is up to you whether before getting married, you want to be in 3-year relationship or 6-year relationship. So the stat says that if you are more days in relationship, you'll have more confidence, you'll have more control, and you feel your decision making is good. So again, it all is in your, it is just a state of mind. So the pulmonology in a very good institute versus medicine in a less famous college. So it is always a branch. When you want to get married, see the person, not the place. So whom you are getting married here is important. Is it medicine or pulmonology? So if you are passionate about medicine and you are getting in a less famous college also, go for medicine only. Go for medicine only. So, but still you are not getting medicine, then you can go for pulmonology. No issue. It will not disappoint you. So breakups are common these days. So if one is not available, others are always ready to receive. So we as a pulmonologist or respiratory medicine branch, we all take up those breakups who had who broke their dream of getting into medicine. So I usually deal with them, no issue at all. Whether to opt diploma course. Now there are 2 years courses in majority of institutes. So most of the diploma students are my students. Unfortunately, we had very good passing rate in when they have completed their diploma also as a part of my resident course. So this is what I want to advise you. When you are not getting any other clinicals or very much interested in pulmo. See, other diplomas are also there, Ophthal, ENT, mostly surgical diplomas are there. So I feel only this is that medical branch diploma, and you must be ready. Not just diploma, post diploma DNB, another 2 years you should be able to spend. So if you can spend 2 years in diploma and you can clear post diploma DNB and get again into respiratory medicine, so then you can actually explore the depths of the field and you will be not inferior to anybody in the field. So many are discouraging me into this due to TB and limited cases. What to do? So again, somebody will ask me the same question. Risk of TB everywhere. I told you na last 10 years of my teaching experience in medical college, where we have about 80 bedded respiratory medicine ward, and daily we see OP and we get MDR, XDR case also. None of our residents have developed tuberculosis, because they are tuberculosis. You take good precautions. And once again, limited cases, no branch will fetch you name and fame, my dear students, instantly. So let it be limited also. Make sure you are doing comprehensive workup and make sure you are only the person that is capable of taking care of that limited case completely. Then you will be the boss. So you no need to know 1,000 tricks. Same trick, if you have practiced 1,000 times, nobody can beat in that. So this is what I strongly believe. Okay, as Bruce Lee has said. So no need to know about 1,000 things. One thing, 1,000 times you practice and let everybody know you are the master in that thing, then people will come automatically to you. Then it is an individual's hard work and passion that will make you want to flourish. So without hard work and without dedication in initial 5 years, so you cannot be successful students. Many people will ask, after seeing few Instagram reels, people going to some vacations. So if you're a first generation doctor, only your degree cannot make you to go through places which you haven't dreamt out without earning. So you need to earn means you need to spend at least 5 years putting your complete hard work and dedication and developing a name in that place. So then after 5 years, so once you have a good team and people to work under you and for you, you can enjoy life. So let it be any branch. So just after coming out of residency, so whatever you see in Instagram and WhatsApp status are not true. Only 1% may be doing it, but 99% will be working in silence. Then should I take MD or DNB? So my suggestion is any government MD is slightly superior, because by chance tomorrow you want to get into medical college as assistant professor. See, only for UG curriculum, they have excluded respiratory medicine. PG curriculum, respiratory medicine is an essential component. They will be recruiting assistant professors, don't worry. Their DNB, their MD might be slightly edge. And whereas private college MD in city versus established DNB in city, so I feel both are nearly same when compared to MD in private small towns. So India has very high burden of respiratory ailments. So most of the cases and interventional courses will be concentrated in places with high patient input according to the preference order above. So government college, so blindly you can take in a city. So definitely most of the cases will come there. Then I would like to ask Dr. Jaisurya to join the session now. So because this was my perspective of respiratory medicine after an experience of 10 years. So now after experience of 1 year, let us see what are his questions. Yes, Jaisurya.
Good evening, sir.
Yeah.
Sir, I have collected some set of questions from aspirants who are planning to come into Department of Pulmo. So most of it, I have the first question is, how is work-life balance? Can we get some free time? What do you think, sir?
Yes. So my definition of work-life balance for a pulmonologist is going to be shown below. So your quality work will give balance to somebody's life. So that is the work-life balance I expect, because you are working. So whatever you do, a patient with tension pneumothorax, midnight 10 o'clock. So you might be out. You are saying that I'll not come. So who is going to save that patient in your hospital? So sometimes your work will provide balance to somebody else's life. But don't think throughout your life you have to run around 24/7. See, my suggestion is always have work in a team. So this is an era of team practice. So previously, one person 24/7, he used to see medical college, he used to go for conferences, he used to be in critical care, he used to do interventions. So there you try to limit your things. So you give quality time for other things also. So you have 2 or 3 people with you. So let everybody earn together. It is not like if you do everything, you might be earning 10 to 15 lakhs per month. But you will not have time to spend that 10 to 15 lakhs. That is what I want to tell you. Have 2 or 3 people, let you earn 5 lakhs, 5 lakhs, 5 lakhs, and you will have good amount of time to spend. And what I feel, to have a tag of lifesaver is very much higher than any other tag in life. So tomorrow, if patient says that, doctor, you came at this point of time and you saved my daughter's life. So there was a massive hemoptysis case with a clot in the trachea. So even if you intubate also, sometimes you might not save. So you need to do a bronchoscopy. So there is a big foreign body. Within minutes, baby is going to collapse. You need to remove it. Or there is a tumor obstructing airway. So airway emergencies are most dangerous emergencies. So that's why being a lifesaver is bigger than any other tag, and work-life balance, we should all concentrate. So that's why I have group practice. So at least 3 or 4 people or 1 or 2 people who can work with you. So that will reduce your stress, and you make sure once in a day, once in a week, you go for emergency call duty. Okay. So in that way, you can maintain that work-life balance. So next question.
The next question is, sir, most of the aspirants before coming into a branch, they just not think of the MD. They just think of things after the MD. What am I going to do? Will I get a job? It will be easy to get me a job. Well, that's the major question, sir.
Okay, job, like I told you, you can go for an medical college. So if you don't want any complications, so medical college will be that 9 to 4 job, or you can open your private setup. So limited setup. See, for a respiratory medicine specialist to look for the common cases such as asthma, COPD, bronchiectasis, pneumonia, literally he doesn't need any investment except a good litmus test. And somebody nearby can help you to have a X-ray. So you can have a minimum private setup, and or you can go into a corporate hospital. So there you can involve in interventional pulmonology, and critical care. So it all depends upon where you want to be. And also the salary will be very high here, good here, relatively less here. So if you want to get into job, these are the options available. Yes.
Okay, sir. Sir, next question. What are the fellowships available after MD, sir?
So right now, the hot cake is interventional pulmonology. So there are about 10 to 12 institutes in India giving good IP fellowships. And critical care, you have more than 50 institutes. And allergy, we have 5 institutes. So sleep, relatively less, 2 to 3 institutes are giving fellowships. So once you get into post-graduation, you don't worry. I know people from all these places. So I can at least guide you how to apply to fellowship. As far as in India, I'll be there to help you.
Okay. Thank you, sir. So you already talked about the NMC statement on removing it from UG curriculum. Is there any future they can come on MD, sir, to remove it from MD and
Yes.
just focus on DM?
Yes, good question. See here, MD respiratory medicine and DM pulmo. So now there is a what you call a rumor that they are going to cancel MD respiratory medicine and they are going to convert everything into DM pulmo. See, but one practical thing is a degree awarded can never be taken back. See, after independence, you tell me how many degrees after post-graduation have been taken off? So the answer is nil. Nothing has been taken off. So they have remote diplomas, but they do not prohibit them from practicing. So still you can see in many small setups, diploma gynecologists, diploma ophthalmologists, diploma pediatricians earning 10 times when compared to MS OBG, MS Ophthalm with 10 to 20 fellowships. So even if they try to convert into DM Pulmo, your degree will remain the same. Now, like I told you, 800 respiratory medicine residents, 70 to 80 DM Pulmo residents. So how can they match that 1:10 ratio? And for DM Pulmo to be sanctioned to an institute, you need equipment worth of few crores of money. The government always will try to save money, will try to reduce the burden. So they cannot convert this into that, saying that we want to remove respiratory medicine. It is not going to happen. So practically, I feel this is never going to happen. And I told you now, 10 years into my practice, I am not worried about it because I know that my degree can never be taken back. And my patient, when he sits in front of me, he sees as a respiratory medicine specialist. He's not worried whether you are MD or DM. So whether I can deal with his lung problem or not. So I think that should not be a hurdle for people coming into respiratory medicine.
Okay, sir. Thank you, sir.
Yeah.
One more doubt is actually, once I complete my MD, I am surely planning of opening a clinic, sir. I want to start a setup in my place. How much will it cost me? And do you think I should start with IP at the beginning only?
Okay. So my personal suggestion and what I have also done is, so I started an individual OPD with my colleague, group practice, 2 pulmonologists OPD. So it cost me very minimal things. So whereas IP, I do in a corporate hospital. So I admit in corporate hospital. So once after 5 to 7 years of doing this, so once you get sufficient money, then you can put your own setup with interventional pulmo and critical care. So this is what I tell to all first generation doctors. But how much will it cost for individual OPD? So when compared to other subjects, so you don't need anything. So you just need a set table, few interiors, and your clinic, what you call a pharmacy, enough. So even X-ray you can do outsourcing, lab you can do outsourcing. or if you want to have a what you call a medium scale IP setup. When I started the interventional pulmonology procedures in 2016, there were only foreign scopes, Olympus, Fuji. So at that time, their initial cost was very high, 20 lakhs, 30 lakhs. I could not afford. So what I did was, I have taken it in seconds. So the bronchoscope that I have bought in 2016 was around 6 lakhs. By now, I have done more than 1,000 bronchoscopies, and the money has come back to me within first 2 years only. And the good thing is now we are having many Indian companies which are very cost effective. So IP setup also, you start with the diagnostic IP initially.
Okay.
Once you get a good patient pool and you are confident that you can invest, then you can go for one setup and both interventional pulmonology, both diagnostic and therapeutic with critical care.
Okay, sir. Thank you, sir. Sir, also we need a comparison on joining medical college versus corporate versus own practice after MD. If
Okay.
possible, can add an update on life abroad also, sir.
Okay. This you're asking to a person who has tried everything. So medical college, I worked as an assistant professor. I'm doing. I worked in both the private medical college, government medical college. So I own my own practice, a small OPD, and the procedures that I do is generally in a big corporate hospital. So actually, you can manage these three things without any issue. So no problem at all. But my advice to just passed outs is always have your own OPD. So even if you are doing a 9 to 4 job, so let it be in a medical college or a big corporate hospital, at least have 6 to 9 your own OPD.
Okay.
Own OPD, at least for 4 to 5 years. So my sincere advice is, so there is no branch giving you lakhs and lakhs of money immediately after passing. So do you know any branch like that, Jayasuriya? Just you have passed out, they're coming to you. So we are giving you a package of 10 lakhs per month. No branch is like that. It's not possible.
Yeah.
You have to work, but make sure you're working in a peaceful environment and you take breaks, no issue. So if it is Sunday, you tell I'm not going to come. If it is Saturday, you tell I'm not going to come in the evening. So it is all up to you. So you can manage between three very easily: corporate, medical college, and own practice. But you should know your limitations and you should plan properly. So you should keep a specific time frame and you should inform them that I'm going to come in that time only. So you make sure you're making the patients and the management aware that you will be available in that time. So for any practitioner to be successful, so there are few things that I want to say. He should be available at any point of time, at least in the initial days, because patients are like, if you're not available, they go to another doctor. So that is very important. Next.
Okay, sir.
Life abroad you have asked. Actually, in US, MD respiratory medicine or any MD you do, so you cannot directly go and practice. You may go for a few fellowships. You have to clear their MLE. So in Middle East, you have one good option after clearing their license exam. But most of the people go to UK. But here, the path for fellowship is easier. But I feel what you learn in UK in 1 year, you can learn in 1 month in a good respiratory medicine setup in our country. Because the number of respiratory cases and the number of interventions that we are doing in India, even UK people are right now seeing India for interventional pulmonology. So that I can watch. So when compared to the other countries in the Western countries, so our people are doing a lot of interventions and research in respiratory medicine. So again, I'm saying 1 year, what you see there, 1 month, I can show you an institute who does the same amount of procedure. But still you want to explore that places for fellowship. Either you can complete MRCP 2 parts and go there, or as a part of medical training initiative, you can be there. But to go as a consultant, there is a separate pathway. So previously it was called as CESR. So you have to stay there for 1 to 2 years. You have to be under their observation. Then you will get a specialist certificate. Then you can go as a consultant. But right now, what I feel is the whatever is available in UK, US is also being available in India as far as interventional pulmonology is concerned.
Yes, sir. Sir, a final question, sir.
Hmm.
While joining into MD Pulmo College, what is the checklist to look after, sir? It is
Okay.
caseload with academics and an exposure of international pulmonology and ICU setup, sir. What are the things to look after?
I'll tell you my personal experience.
Sure, sir.
See, I joined in medical college where never I held bronchoscope or thoracoscope in my hand. 3 years of my residency, I never held them. But I can say that I joined an institute where there was a huge caseload and frequent academics. So most important for a physician is mental skill or that abstract thinking, that mental skill or abstract thinking when compared to physical skill. So interventions, all these procedures, bronchoscopy, thoracoscopy is more of physical, and you should have some mental skill also. Then you need to know in whom you have to do. But I feel where to do, where not to do, that caseload and academics will keep you there. And you can take me as an example who never held a scope in throughout his PG career, is now teaching procedures to postgraduates, conducting workshops. So it will give you confidence. So ideal scenario is all this: caseload, academics, intervention, and ICU exposure. But less ideal scenario, I always go with caseload and academics, because you must be knowing, when compared to other people in other medical colleges, you have done your ICD within 3 months. So
Yes,
you
sir.
can now independently put ICDs, you can do pleural procedures, you can go diagnostic bronchoscopy. Once the caseload is there, everything you will learn simultaneously.
Sure, sir.
And what interventions? So most of the medical colleges, you will look for diagnostic interventions, diagnostic bronchoscopy, diagnostic thoracoscopy. So these are the interventions part at least. So going into EBUS, rigid, cryo, APC, all these are higher level. Many medical colleges may not afford. See, only if you be a good pulmonologist, you could be a good bronchologist. If you are a good bronchologist, so then only you can be an advanced interventional pulmonologist. So that is a sequence: good pulmonologist, interventional pulmonologist, advanced interventional pulmonologist.
Okay, sir. Thank you, sir, actually, for clearing all the queries. It was actually very good, sir, because people who had all the doubts has been cleared almost in this session. I think it will be helping for the upcoming at least 2 to 3 years until we get some new things into our department.
Yes. I have few questions here. Sir, how is medicine for girls practically? So most of the people coming into general medicine or these days females only, and I have seen most of the faculty and also consultants outside also females. So no need to worry. General medicine will be good for you. No problem at all. Sir, DNB is an exam. Why even MD can get no after giving? So why DNB? So it is just like an additional degree. So MD people can write DNB exam. So I wrote it after 7 years of completion of my MD to make sure I know what is being asked for MD students, I mean DNB students, so that I can teach my residents. Sir, can you name some good MD and DNB colleges? See, when I say this is the best, so I cannot point out that this is not good. So you can always message me which place you are interested to take, or any institute that you are wishing to. So fortunately, now I am connected to majority of residents from top to bottom of the country, because I have a resident pulmonology course which has more than 600 residents. I'll give you all the information talking to them. So because this is a public platform, I cannot grade the institutes, because in most of the institutes, people are my friends and they're like my family also. Sir, please elaborate on respiratory medicine practice after 10 to 15 years, considering reduction in TB cases. See, Sirisha Anumasagar, respiratory medicine is not just TB. So in UK, US, there is no TB at all. Still highest earning or pulmonologist. You have lot other things. So as you go to the next 10 to 15 years, pollution increases like anything. More of COPD, asthma will be coming to you. So can I do cardiology? Yes, you can immediately do cardiology after doing MD pulmonary medicine. You have to clear NEET SS students. So DNB respiratory medicine or DNB MD emergency medicine. So I want to ask you one question, Dr. Induja. You want to sit in emergency medicine department or you want to have an OPD? So if you want to sit in OPD and treat every case like a boss of that field, go for respiratory medicine. Or you want to be in emergency medicine, save life of every patient coming to you and later transfer it to somebody's name. So it is all your personal interest. But the trend is now respiratory medicine. So this is my WhatsApp number. So you can contact me in this number. So I'll let you know what are good institutes depending upon your interested place. So Jayanathan, how is VP Chest is one of the best institute in the country. So what are the good colleges for pulmonary medicine in Tamil Nadu apart from MMC Stanley? So Madurai is good. I think Dr. Jaisurya is from Tamil Nadu only. You can throw some light on Tamil Nadu. Say which is good.
Actually, Madurai is good and even Tirunelveli is good, sir. According to my knowledge and my talkings with their pages, Tirunelveli is good, Kilpauk is good, and Madurai is also good, sir.
Okay. So then what is
one more thing, sir. If you are getting CMC Vellore, you can go for CMC Vellore too. It's very good, actually.
Okay. Very good. Then what is it take home salary of general medicine and respiratory medicine? So if you don't do procedures, general medicine will have higher salary. So in a corporate hospital, 1 to 1.5 lakh for general medicine and nearly 1 lakh for respiratory medicine. But if you do procedures, so one bronchoscopy that you do will give you around 8,000 and one thoracoscopy 20 to 25,000. At least if you can manage 10 to 15 procedures ethically also, you'll have good amount of money. So specific college dots, you can contact me on WhatsApp. So I'll get people from your preferred place. You don't worry. Okay. Is it advisable to go for Rajasthan for MD, respiratory medicine, being a Tamil Nadu resident? Yes, we have so many Tamil Nadu people in Rajasthan, Jaipur working there. Sir, is there any chance? Okay, Dr. Jaisurya, you can take this question. His rank is 14,000. Is there any chance of getting MD respiratory medicine?
Yes, sir. Last year, till final round, it went till 15K. So is there chance, sir? There's a chance. Because of seats getting increased this year, in some institutes, he might have a better chance, sir, for getting MD, but he has to wait till round 3 at least.
Okay. So then good colleges for respiratory medicine in AP. So we have starting, I'll come from top to bottom. We have Vizag Andhra Medical College is good. SV Medical College Tirupati is good. Kurnool is good. Guntur, all are equally good. You don't need to worry. I stay in Andhra Pradesh. So you can reach me out for any college that you want. So before we conclude, because you have just completed your first year residency, Jaisurya, tell me
Yes,
your experience as a respiratory medicine postgraduate in one of the centers. See, the center that we work in has daily OPD. So Monday to Saturday without any break, 9 to 4. And on an average, we see around 100 patients daily in OPD. And in the ward, we are having more than 60 patients with floor beds. And we perform ICD, bronchoscopy, thoracoscopy very frequently. As a first year postgraduate, you tell me your experience. How are you handling the stress? How is life here?
So actually, we feel very occupied, sir. In the beginning, actually, it was overwhelming. Like we couldn't focus on things. But once after 3 months or 4 months, when we go for referrals and when we see emergency cases, we thought that we can manage. Now, by the end of first year, we feel that we can manage a case, at least initially. Till our APs or our professors come into, we can handle the case and we can give some initial things for the patient to save him. Then after that, we can get their opinion, and for further progression and further prognosis, that's good, sir. To be honest, I never felt bad after taking Palmo. I feel it's a good decision in my life. And I don't think it has a cons. And people telling regarding occupation risk, as you told, we are very much cautioned about that. We have some good diet. We're very much cautious about wearing masks and using sanitizers. So I think that cons should be taken away from our side at least.
So then elaborate on prep for DM Palmo after MD Palmo. So, see, how did you prepare for your NEET PG? In the same way for NEET super specialty also, it is an MCQ based exam. So you'll have a few set of books and sources. So once you get into pulmonary medicine, you let me know. I will give you all the sources that you need to study. And if you are interested, you can also enroll in various courses available. Now, everything is just at the distance of a click on your mobile. So you have separate apps, textbooks, courses, everything available. But make sure don't again do the same mistake that you have done previously. First year, no DM preparation, no nothing. Only one thing, see cases, see cases, see cases. See, patient and life is not an MCQ always. So life is about talking to patients, communicating them. So communicating with, I have seen so many DMs, so who boasts of multiple fellowships don't have sufficient number of patients coming to them. The reason is they don't talk to people. So they just think it as also an MCQ. So I don't like ICU, not at all interested in critical care. Yes, you can limit to OPD cases. So most of the previous generation pulmonologists have earned their name and fame by seeing asthma, COPD, and various other cases. It's all up to you. So you can focus more on allergies, sleep. So you can subspecialize, no issue at all. Is it better to do in a peripheral college native state or good institute in other state? So I feel that as far as case load and academics, because respiratory disease is a high burden thing, you can go for your native state only, because tomorrow if you wish to practice there, you can build up good patient load there. Anything else, students?
Sir, I have one more doubt here.
Yes.
Sir, cases that internal medicine handle are respiratory medicine. Like they're telling that even general medicine physician can handle our cases. What's your take on that, sir?
So let them handle what's there. See, general medicine means he can take whatever case he wants. So he handles even cardiac failure. So put diuretics. Has cardiologist become jobless? He will handle CKD. Has nephrologist become jobless? He will handle DKA. Has endocrinologist become jobless? So when compared to those cases, the number of pneumonia cases, asthma that I see are 100 times more. See, let them take whatever case. I don't think that somebody is a competition to me. I feel I should be in a situation that patient should feel that he is the only competent person. So don't take anybody as your competition. Make sure you project yourself the most competent person. Let it be in real life or in social media. Patients will come to you.
Okay.
Don't worry about competition. Try to become more competent. That is the take-home message.
Sure, sir.
Okay.
Yes,
So I
sir.
think we will conclude, because next will be an extraordinary session by Dr. Srinath sir, exploring regarding medicine. So thank you once again, Dr. Jayasurya.
Thank you,
So
sir.
yes, it was really good sharing this platform and clearing doubts of many of the students. So whenever you want to get into respiratory medicine, so you should also have some interest and passion. because sometimes the things that you are going to do can completely change the outcome of a patient. So each and every step that you take can have lot of impact on a patient's outcome. Okay. Thank you.
Thank you, sir.
Yes.